engage your core, tighten your tummy, hinge at the hip, don't tilt your pelvis. These are all things you've heard people tell you to do or not do while exercising, and you probably don't know how to do them. Hey everyone, it's Dr. Andrew. Today we are going to talk about some common phrases that you hear in physical therapy and in the gym, and phrases and terms that you may not be familiar with and that may be a little confusing. So we're going to help you out with that. But first, if you would like this video, subscribe to my channel. We're going to be putting out a lot of really great information for people who want to avoid pain and want to become more aware of their body and how it works. So please like and subscribe. That would be awesome. So before we explain those common phrases, I really want to go over the anatomy of the pelvis and of the low back and of the hips. So if I would have my beautiful wife, Krista, come in. Thank you, Krista. And what we're going to do is we're going to use Darth Skeletor here. And we're going to, this is the anatomy of a spine, the hips, and then the top part of, or the pelvis and then the top part of the hip, okay? So we're going to compare this with human anatomy on an actual human. Okay, so now Chris is going to go ahead and stand up, and we're going to find these landmarks on the skeleton and then match them with Chris's pelvis and body, okay? So first thing we're going to look at is the ASIS, okay? It stands for something very, technical and medical, but it's not important that you know that. ASIS, and then your PSIS. A is anterior, P is posterior, okay? These are nice, good bony landmarks that you can find on yourself for when you're doing exercises and for things we're going to explain later. So this front part right here on the top of the pelvis, you're going to find right here in kind of the underwear and the pants line, okay? And then the back side, you're going to find right here, kind of above the middle of the glute. You're going to find that bony part. And then there's one on each side, obviously. And then, of course, right here, one on each side. All right, so next thing we're going to look at is the greater trochanter. Okay, this is the part of the femur where a lot of muscles attach, and it's a very bony area that a lot of people can feel. So what we're going to do is find the top of the iliac crest, which is right here. So we can find that too. We'll find this part. This is the top of the pelvis, the top of the iliac crest. So basically right in here, okay? You kind of have to push a little bit to feel it. And then if you go straight down from there, down the side of the hip, you'll find the greater trochanter, which is right here, okay? All very important landmarks when we're talking about the hips, the pelvis, and the low back. Is it weird that I'm on my knees? No. Okay, so now we're going to talk about the phrase, engage your core, or tighten your belly. Basically what they're saying there is for you to tighten your abdominal wall, okay? You have your rectus abdominis that attaches, if this guy had a sternum and some ribs, then we would see the rectus abdominis, which is those six-pack abs, that you have. They attach to the ribs and to the bottom of the sternum, and then they come down right here, and they actually attach right here to the pubic region of the pelvis, okay? So when you think of those muscles, we think of crunches, okay? We think of going down like this and kind of flexing our spine. So when we say tighten your core and engage your belly, engage your core, tighten your belly, stuff like that, we aren't saying to do that, okay? Because what we want to do is we want to keep a neutral spine. And if you do that, then you're going to curve your spine, especially the low back. And we don't like that, especially if you're lifting things. So what we're actually talking about are these other muscles that are right here and then right here. You have your transverse abdominis muscles, which are your TAs, and you've probably heard of those. Those are the ones that we're really trying to get at here with tightening, okay? So Krista, when we want to tighten the TAs, back up just a little bit. When we want to tighten those TAs, basically what we're trying to do is think of it as you're at the beach and you're in a two-piece, okay? Or if you're a guy, you have your shirt off. And your belly's kind of poking out a little bit, and then a pretty girl or a nice-looking guy walks by, and you want to make yourself look a little bit skinnier, okay? Which, nothing wrong with that. But basically what you're going to do is you're going to bring your tummy back, you're going to bring it in, and then kind of up just a little bit, okay? We're not crunching down, You wouldn't go up to them and be like, hey, baby, what's up? Okay, you want to suck in and then up just a little bit. So to do that, what you can do is put your thumbs right here. So put your thumbs right here on the sides. And then now you want to bring your belly in towards your spine and then kind of up just a little bit. All right, and you should feel right here under your thumbs, you should feel muscles right here contracting. So then relax. All right, so now we're relaxed. Okay, we're a little bit squishier. Not very squishy though. And and you're gonna do it again. So suck just a tiny bit in. Okay, and then hold that right there. Now, she's still breathing. Can you talk?
Yeah.
Okay, so these are muscles that you should be able to contract and still be able to talk and breathe, have a normal conversation while you're doing it. I'm doing it right now. I'm holding these TAs, I'm contracting my core, I'm engaging my core, I'm tightening my belly right now, and I'm still able to breathe. Basically, this is the idea of tightening your belly and engaging your core. All right.
I don't know what to do with my hands.
Am I just weird sitting down here like this? So the next common phrases we're going to look at are hinge at the hip and don't tilt your pelvis. So basically what we're saying there is we have our femur, okay? We have two femurs. They're normally a lot longer, okay? And they attach right here in the pelvis, in the hip joint. So what we want to do when we say hinge at the hip and don't tilt your pelvis, tilting the pelvis is this. It's when the low back bends backwards, or it's when you tilt forwards like this, okay? And as you can see, there's a lot going on in the lumbar spine when that happens. And a lot goes on in the SI joint. And there's so much going on. This is a whole other video that I'll probably do. So you're tilting here, you're tilting there. That's not what we want, okay? We want you to maintain your normal posture, okay? We want you to engage your core. And then when you hinge at the hip, that means that you're bending forward from the actual hip. Bending like this, and then you're coming back up, okay? Bending here, and then back up. This is something you do with deadlifts, with squats, with bending down to pick something up. The hinge at the hip is extremely important for exercises and just for everyday life. So what we want to do, when we do that, what we're actually doing is we're contracting the glute muscles, because the glute muscles, you have your glute maximum, your glute medius, your glute minimus, you have your piriformis, you have your external rotators. All these muscles back in here attach on the pelvis, and then they come down and they attach on the femur. So if you are squeezing these muscles and using these muscles right here, then those are the muscles that are going to help you move like this, okay? What we don't want is for you to use these back muscles to lower and then come back up, okay? Because your back muscles, they're not built for that, okay? But your glutes, they're huge muscles. Those are built for that. So to make this more real, we're going to use Krista again. So come over here, Krista.
This way?
Yeah. And so we're looking at the greater trochanter. Remember that? That bony part right here. Not way up here, okay? But down here. So what she's going to do, in order for her to actually hinge at the hip to bend forward, she needs to engage her core like earlier, okay? She needs to contract those glute muscles, and then when she bends forward, she is going to actually, her bottom and her thighs are going to go backwards as her trunk comes down forward. Okay, so do a hip hinge. So she's going backwards and then come back up. Very good. So all that movement is coming from down here in the hip. Her low back is staying neutral, and when she comes forward, she's tilting. She's moving the pelvis and the low back together, and she's moving over that hip joint, okay? So just to look at it one more time, we're here. The legs are stable. Low back is stable. This guy needs some help. He needs some muscles. And she's going to lean forward like this, come back up here. Lean forward and come back up. Notice the back is staying nice and strong. There's no breaking here. All these muscles are going to be fine. The disc, there's going to be no added pressure on the discs, okay? And you should feel all that in those big glute muscles. Okay, so now we've talked about engaging your core, tightening your belly, hinging at the hip, and not tilting your pelvis when you're doing these exercises and when you're doing these movements. I hope you learned something today. Now go do it yourself, and if you have any questions, leave a comment. Stretch what your mama gave ya.